A woman should not be soaking through pads or tampons just with regular use or changing them every few hours. If they're bleeding so heavily that it's actually pooling in the vagina or the uterus and forming clots, that's really an indication that the bleeding is not normal. Certainly women who are younger, in their late teens and early 20s, can experience some abnormal bleeding. Most of the time it's because of some hormonal cause. Women who are over 35, we get concerned about structural abnormalities or even some precancerous or cancerous conditions. Typically, we start by examining the patient and doing some sort of imaging test, which is usually an ultrasound of the uterus. We're trying to determine, is the bleeding caused by something hormonal? Is it structural? Is it potentially something cancerous or precancerous? Uterine prolapse is basically where the connective tissue structures that typically hold the uterus in place in the pelvis start to become weaker, and they start to relax, and the uterus will start to come down through the vaginal canal. A lot of women will experience it because of the trauma that was related to pregnancy itself, and then of course childbirth as well. Some women will just, they can feel like a pressure sensation in their vagina, and other women actually experience the uterus coming completely out of their vagina. They can also have other symptoms like feeling like they have to have a bowel movement more frequently because of the pressure, and they can also have urinary urgency where they feel like they have to pee more often. And then on the other extreme, they actually can have a hard time completely emptying their bladder because the uterus is pushing so heavily on the bladder that it's keeping the woman from being able to completely evacuate the urine from their bladder. When I see a woman and she has uterine prolapse, we have to kind of make that decision, okay, how much or how little treatment does she want to do? Are the symptoms that this woman having purely related to the anatomic changes that are going on, or is there some sort of neurologic change that's happening as well? By the time the uterine prolapse gets bad enough to cause symptoms, most women are done with their childbearing. So hysterectomy certainly is an option. For women who don't want to lose their uterus or for whatever reason want to maintain their fertility potential, things like pessaries can be placed inside the vagina to add support to the uterus and keep the structures from falling down. And then there are some surgical procedures that can be done to actually give this uterus support as well. I think a lot of women, especially when you're having the bowel issues, they think, oh, I'm just constipated, it's because I'm getting older. They don't realize that it's because of some sort of structural abnormality. Women typically will not die from uterine prolapse, but this type of condition certainly can be threatening to their lifestyle. It can inhibit them from doing the things that they normally do on a regular basis, or can cause them discomfort or pain. When I see women for any type of problem, not just uterine bleeding or the urinary problems that they're having, the threshold that I tell them is that if these problems are affecting their ability to function on a day-to-day basis, then it really is imperative that they seek some sort of workup and some sort of treatment for that. And if they experience that physician or whoever it is that may discount them and say, well, no, that's just the way it is for you, I'd really encourage them to see somebody else, because again, if those symptoms are affecting their daily activities, that's not normal.